At the recent meetings of the American College of Obstetrics and Gynecology, our frequent Healthy Life co-host or guest host, Dr. Jacques Moritz, interviewed Dr. Kevin Ault, who is Associate Professor of Gynecology and Obstetrics at Emory University School of Medicine. The topic was human papilloma virus.
For our viewers out there, all the gynecologists know here what HPV means, human papilloma virus. Tell us what it means for viewers out there. They didn't know about HPV, and now they're going to their doctor and they're getting phone calls saying their HPV is positive. What's it mean?
Well, human papillomavirus is a whole family of 100 or so viruses. About 20 of them cause problems for women. It's been associated with cancer risk, really. There are several types that infect the cervix, then they greatly increase your risk of cervical cancer, even beyond what you might associate with smoking and lung cancer. It's even a couple orders of magnitude above that. So I think the reason maybe you didn't hear about it is it's a tough one to study in the lab. You can't really grow it in a test tube and study it like we can other bacteria and viruses.
Right, but HPV causes warts, am I not mistaken? So what's the difference between a wart on your hand and a wart on your private part, if you will, and then a cancer on your cervix? Because, you know, that runs the risk from I have a wart on my hand to I have a little wart here to
Sure.
I could be dying from cervical cancer. So when women hear HPV, all they hear is cancer.
Sure.
And they just, and so tell women out there, you have their attention now, how do they figure out when to be nervous and when not to be nervous?
Well, warts on your hands or on your genitals don't turn into cancer. It's really just the ones that are associated with abnormal pap smear. So what's happening in the United States right now in 2008 is that we use the HPV test for women who have a minor abnormality in their pap smear to really try to figure out who's going to have problems with precancerous changes and who isn't.
Okay, so now we have a group of people that have a pap smear, it's abnormal,
Right.
and their doctor says, by the way, also your HPV is abnormal, so it's a cause and effect.
Exactly.
You have the HPV, it caused an abnormal pap, we're going to take care of it. Is that correct?
That's correct. You probably know that about 7% of all pap smears we do are abnormal. Certainly a vast majority of those are really minor abnormalities. So we've used the HPV test to really kind of focus down to the people who are going to have problems. All people that have a precancerous change are going to have an HPV infection. The opposite's not true. Everybody with an HPV infection doesn't get an abnormal pap.
Right. And this is where the area that seems to bring up the majority of concern among viewers are their doctor calls and says, good news, your pap smear is normal, but your HPV is positive. And all they remember is the HPV can cause cancer.
Sure.
So which one is more important? Is the pap smear more important? Is the HPV more important? Which one's the important one?
Right now in 2008, I think we think the pap smear is the most important, but I may change my mind in 2009 or 2010. It's an area that's very intensively investigated right now. It's clear that it really works the best for women over 30, because if you would go out and test 20-year-olds, you might expect 20 to 60% of them to have HPV. Most of those are not going to be precancerous, not going to be cancerous. But as you get older, the percentage of women with positive tests go down, and the rates of cervical cancer increase. So that situation you said is one of the most problematic. Maybe that's why you asked, because
right.
Normal pap smear and positive HPV tests, the odds of you having a precancerous change in that category are still less than 10%. So just knowing that information might have you get a couple of extra pap smears or maybe some extra tests in the year after that diagnosis, but certainly doesn't mean a cancer diagnosis.
Right. Now, the next question that everybody asks, and I'm sure you get the same question, is can the HPV go away? Can I get rid of it? Is the body going to take care of it, or do I have it for life?
Well, the younger you are, the more likely you are to get rid of it. I think it's clear from the new pap smear guidelines, we're really not doing a lot of pap smears in women in their late teens and 20s, because almost all those HPV infections and minor pap smear changes go away. As you get older, unfortunately, you can't get rid of it as well. So it means a little bit more when you're older, but still a majority, no matter what age of women you look at, are going to go away.
Right, and give some advice to the women out there on how to make the HPV go away, and if they have an abnormal pap, how to make it better, if you will.
Well, there are a few things you can do. Thing number one I usually tell people is quit smoking. You know, if you're 20 years old and you smoke and you think you're not going to get lung cancer until you're 50, here's something really right now that you can do that smoking is affecting. You know, smoking might be causing your genital warts or abnormal pap smear. There's been a fair amount of study about nutrition, and it's just common sense things your mother probably told you. You know, more B vitamins, that type of thing. Folate is good for you. Fresh vegetables are good for you. So most of these things are common sense.
Now, I just want to back up 1 second. This human papilloma virus, this is a sexually transmitted disease.
Yes.
The next question that always comes up to mind is, number one, if somebody asks me a question and says, have you ever had an STD, do I say yes? And number two, if you're in a new relationship and you're a woman, do you do full disclosure on the second or third date and say, just want to let you know I have an STD, but don't worry, I'm following it?
Well, there's a couple of ways to approach that. There's no test for men. So, and male studies show that they have the same rates as HPV that women do, or maybe even a little higher. So there's not an equivalent disclosure, unfortunately, for the male partner. So, but yes, certainly full disclosure, good idea, but most sexually active people are probably going to get a HPV infection sometime during their life.
That's it for this edition of Healthy Life. If you want more information on these or other subjects, go to abcnews.com, click on the health page. We thank you for joining us. I'm Dr. Timothy Johnson.